And Nichola, welcome to the podcast. Now, why don't you start off by telling everyone a little bit more about who you are and what you do?
Thank you, Adam. I really appreciate being invited to join you today. Like you said, my name's Nichola. I am privileged to be the CEO of Healthcare Management Trust. I've got a long, extensive career across health and social care services, probably spanning over 20 years now, which is quite scary, makes me feel quite old. Um, I've worked in NHS services, historically a very proud clinician, a podiatrist by background.
All
Um,
right.
yes, still clinically
First
registered.
podiatrist I think we've
Yeah,
had. Yeah,
flying the flag for podiatry,
great.
amazing profession. Um, Worked across into education, in acute hospitals. I've worked in housing, and brought clinicians into housing
Right.
services, which is fascinating, and extensively in care
Hmm.
services and various different types of care homes. More recently, in the last 3 years, undertaken a significant turnaround and refresh of Healthcare Management Trust. Um,
Great.
yeah, got a big interest in quality of care. I did a
Hmm.
PhD in concepts of quality in
All
community
right.
services, which I think really helps when you're working in care homes. So yes, that's me. Quite excited about innovation and integration in the main.
Fabulous, fabulous. Great. Well, let's get straight in. Integration across health and social care, big issue, as all issues are in the care sector that we work in. Let's get cracking. Our care homes, can help prevention of hospital admissions. Let's just talk about that straight off. So, tell me what you'd like to share to get going.
I think one of the topics that we're probably all grappling with in care
Mm,
services is the flow of activity and the movement of our residents in and out of hospital services, in and out of their existing homes through hospitals and
mm,
to a more appropriate place, which not for everybody, but for some people, the most appropriate place is a care home.
mm,
And I think what I've experienced and what we need to be better at as an entire system is positive risk taking, trusting, and upskilling in order to assess earlier, and make conscious decisions to allow people to get where they're supposed to be more swiftly and
mm,
appropriately. Because what we see a lot of at the moment in some of our care homes is the more vulnerable residents being moved to us later, really, than they should be, and spending less time in a comfortable place before they
mm,
pass away. What we've been working really hard on is upskilling our colleagues and ensuring that our infrastructure is able to cope with increased acuity so that we can take more poorly people and give them more of an opportunity to be recovered, re-abled, and live a better quality of life for however long that might be. I think there's a common misconception that even if somebody maybe is quite unwell, that the quality of that last 6 months of their life can't be improved and that they can't live well in a community setting for that last six
mm,
months, you know. So there's some of that. I think some of what we see is that, somebody might be on the cusp of what the hospital might think is medically appropriate. So they sit and then they wait and then they get less likely to recover. We know hospitals aren't the best places for people to recover and regain lost skills and lost function. So what
mm,
I'm sure a lot of my colleagues would like to see is earlier decisions being made so that people stand the best likelihood of being able to return to a community setting, be re-abled, and have improved outcomes longer term.
mm.
What we're noticing and what we're consciously trying to do is improve our skill set in care homes and community services
Right,
to be able to meet those challenges and demands.
right.
One example of that is, we employ occupational therapists directly and have
Mm,
them work into our care homes to
mm,
make sure that our care workers, our nurses, we do have a focus on reablement. We do understand, functional exercise, and that we're making best use of every activity to build function, to improve outcomes for all of our residents. I think technology probably also has a significant part to play, and how that we can connect care homes to acute hubs so that you can do
Mm.
increased screening remotely,
Mm.
which allows hospitals and other services, acute services, to build confidence in removing people from a hospital setting and have them recover in a community setting because you can have greater oversight
Yeah, I
of their
see.
medical condition.
Yeah, yeah, and just some of the basics. Your homes, the residents that we're talking about here with higher acuity, are they NHS funded or is it local authority? What's the funding arrangements that those who are not private will be coming to homes?
They're usually the level of complexity that we deal with. It's usually part funded by the NHS and
Right.
part funded
Yeah.
by local authority.
Yeah.
Um,
Yeah.
some placements are 100% funded by NHS.
Yeah. Yeah. I see.
Um,
Okay.
and
And
and we're likely to see an increase in that if we consider the demographics we're all dealing with. There is
yeah.
a aging
Sure.
population.
Yeah. Yeah.
People get older, they get more poorly. We
Mm.
have less availability in hospitals. You think the pressure that we're seeing in hospitals on elective activity, the waiting lists.
Yes.
We all have a part to play in solving the system problem.
Yeah. 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 I see. Okay. So, in terms then of I mean, having the OTs is something interesting to hear. How do we before we switched on the record today, we were talking about the kind of partnerships with the
Yeah.
hospitals and how you're trying to have a communication going with them. So tell me a little bit more about that.
I mean, we've not cracked it. I wouldn't be
Yeah,
arrogant enough to sit here and say we've cracked it. I
yeah,
think it's a topic I'm interested in, and as an
mm,
organisation, we're exploring with partners. So
yeah,
one
I
of the
see.
partners we're working with, it's trying to create those direct access routes of referral
Mm,
from the care home, whatever type of care home that might be,
yeah,
and into the system that NHS services.
yeah,
It can then use the same tools, whether it's frailty, whatever's frailty screening tool, and you can be
yeah.
linked directly to that team, or if
I
you can use
see.
some shared technology.
Yeah.
Um, we're trialing it in one of our homes in the south around the use of certain types of sensors and early screening so that we can get advice earlier to prevent decline.
Ah, right, I see.
So
Yeah.
it's partnership arrangements. They don't always cost anything, but they
Mm,
can radically improve the outcomes for our residents.
yeah.
I think there's a lot more that could be done in private funded care homes around that to
Mm,
give residents better outcomes,
mm.
um, and that would help the system ultimately.
I see. Yeah. So your because you have your care homes, they're in different counties, correct? So
Yeah,
I'm curious to know if this integration that essentially what it's all about is maybe being easier to think about and easier to move forward with certain areas than others. Is that something you found?
yeah, I think it's a great question. Yes, each area
Mm.
is radically different. I
Mm.
think that's one of the challenges for all care home providers where you operate a national organisation or across a number of areas
Mm.
because no system operates the same.
Yeah.
Access routes are different, referral routes are different. Teams are
Mm.
often called different things. You might have a frailty team in one
Yeah.
county, an older person service in another.
Mm.
There are radical differences. So when I'm talking about these innovations, they are genuinely the negotiations we have and the discussions we have around innovation and integration are different across each of our care homes because each of our statutory services work differently. You're absolutely right.
Yeah.
I'm not sure whether what we'll see, over the next 3 to 5 years is radical change
Mm.
in that area
Mm.
with the
Mm.
transformation that we're seeing in the NHS.
Mm.
It would be nice because it would probably allow us all to operate in a more seamless way.
Mm.
Who
So
knows?
yeah. So essentially, with the talk of concerns around bed blocking, you are with your high acuity, your OTs, your team's able to provide a care service to these residents. You see yourself as a solution, right, to the bed blocking issue. Have I understood that
We
correctly?
do. Yeah, absolutely, we do. I think we're trying to position ourselves as an organisation that can operate in that space
Mm, mm,
because of the diversity of what we provide. We're trying to position ourselves as a partner with
mm.
the solution for some of the issues that our statutory services are experiencing
Yeah.
around, older people perhaps, or those with more complex needs who
Mm,
need a community space that's fit for purpose.
mm.
Um, we're hoping that we move to, more bespoke packages where that might be, where we can tailor something specifically for the individual's needs because of the skills that we're willing to invest in community care.
Right,
But,
right. See,
but
yeah,
it's a significant investment. It's,
yeah,
it's not just about employing one individual, it's
no,
about skilling all of your care
yeah,
workers
yeah,
in that team to a particular level.
yeah.
But by doing that, it also offers up increased opportunity for your care workers.
Mm,
Often the most undervalued group of individuals
yeah,
that do a wonderful job, and it gives them scope to increase the scope of their practice,
mm,
gives us opportunity to educate them in a different way and give career pathways and opportunities.
mm,
And the fact
mm.
that we now employ OTs, what we're hoping to do is start doing more apprenticeships for care workers to move into those types of professional
All right.
groups.
Yeah, yeah, I see.
Huge
And
opportunity.
yeah, is this within the within the trust? Is this a change of focus you've had over recent years, or is it? Tell me a little bit more about in terms of the focus on acuity. Is that something that, as I said, has changed, or is this something that's always been in place?
It's been a step change for us at HMT.
Yeah.
So we're now an organisation with a social purpose and mission. We
Mm.
launched our strategy earlier this year, and it's
Right.
around, you know, every organisation wants to have its place in society and
Yeah.
wants to know that it functions with purpose.
Yeah.
Um, our aspiration and our purpose is to work with complex individuals in community
Mm.
settings where we can add value to the community.
Yeah.
Um, we aspire to working in communities where there is an element of deprivation
Mm.
and where we can give back. We are a registered charity.
Mm.
So, our profitability is directly tied to our desire to drive that money back into the business and the
Got it.
communities that
Yeah.
we work.
Yeah.
I absolutely adore my job.
Yeah.
It's a gift to be able
Yeah.
to do something interesting with
Mm.
purpose
Mm.
and make a difference.
Yeah.
Um, and it really helps. Our colleagues are 100% engaged with our mission.
Mm.
And, we've seen we have a really great retention rate of colleagues.
Yeah.
And I think that's because they know why we're here, they know what we're trying
Yeah.
to achieve, and that they
Mm.
know that we want to invest in them as much as we do our
Yeah.
services.
So you have the charitable status, you have a very clear idea of who is it you're primarily wanting, able to assist,
Yeah,
which is your special position, your special mission, if you like. And in terms of, we talked about these different regions and the different
yeah.
individuals who are responsible from certainly from the hospital side. Who from your care home side is going to be like responsible for that liaison and building the bridges and building the communication? Is it your manager or is it someone else?
It's a collaborative effort, so we're really lucky. We've got exceptional registered managers
Yeah,
that oversee our care homes. I've also got a really brilliant director of strategy and business development,
right.
Jenny Mace. Shout out to her.
Great.
Um, and usually, as a small team, they will work on collaborative
Yeah.
projects together. We've got one that's shaping up to be really wonderful, where we've got a really active, engaged, innovative commissioner and commissioning group in
Right.
an area where they have a desire to do more and be more innovative in a community space. And they're
Mm.
moving towards the agenda that we've talked about.
Yeah.
How do we shift activity into community spaces, help people stay in their homes for longer? How did we transform the face of care homes? I think it would be
Mm.
short-sighted of us as care home leaders to think that care homes will operate exactly as they are now in 5 years'
Mm.
time.
Yeah.
Outside of the self-pay market, they probably won't.
Mm.
So we have to be ready to transform and be innovative and work in partnership in a way that we haven't thus
Mm.
far.
Mm.
And I think that's what we're trying to spearhead and lead the way on.
Yeah, I see. So it's commissioners, your teams, the hospitals, it's all about
Absolutely.
having that partnership and communication. Um,
And
it,
building trust, I
yeah,
think that's a big one. Building
right,
trust in us as a provider,
yeah,
you know, showing them that we have a track record. And one of the things, that I think other providers are probably doing great as well, but
mm,
some might want to build upon, is around building that shared quality governance infrastructure,
mm,
shared language. So if you want to take on more acuity, if you want to work closer with statutory services, sometimes mirroring some of the governance arrangements are really useful and have extended quality monitoring in a way that, some providers are doing great,
right,
others probably could build upon that.
yeah,
So and again, I just think it adds value to the colleague
mm,
experience as well.
mm, sure. And tell me a little bit, we touched on it, the role of technology here in both, I guess, on the on the care side and the quality governance side. Tell me a little bit more about that and where you're at with bringing or not technology into your services.
Well, recently we did a great pilot with a company,
Mm.
2IC Care. We worked with them. They use sensors to gather insight and intelligence that drive how you then support individuals. I
Yeah.
think there's probably others in the market, but that's who we've worked with more recently, in one of our care homes. It gives you usable information in partnership with relatives,
Mm.
residents to drive how you care plan, and it gives you intelligent insights into what's happening in that individual's life in a way that you wouldn't because you can't be with them 24/7. So anyway, we gained consent, put sensors into the home, with a key number of residents. The upshot was of the use of the technology, we identified there was a big issue with sleep hygiene and people's sleep patterns in a way that the traditional, just simply acoustic monitoring or our traditional methods of checking in
Mm.
wouldn't have done. What we were able to do was individually assess in a slightly different way. There were some individuals that needed medication changes, others that needed new routines establishing and support to make choices to do that. Um, but ultimately, it resulted in people getting better sleep, reduced falls, improved, I suppose, quality of life for those
Mm.
individuals.
Mm.
Without that insight, we wouldn't have known to have responded in the way that we did.
Right, I see. Yeah.
I think there's big technology that has, that
Mm.
makes big changes, like
Mm.
I don't know, screening in care homes
Yeah.
that you would previously have had to go into hospital for. I think there's huge steps that we can make there. But there's little things that we can do around use of sensors, acoustic monitoring that really enhances the experience for individuals.
Mm.
There's considerations. It all has to be done very carefully so that we maintain dignity and independence of our residents. But a lot of our residents and their families are so keen to be part of the conversation and try new things if it helps their loved ones live a better life.
Yeah, yeah, I see.
So I'm super excited about technology and innovation in care services.
Yeah.
And when you have a really great care home with innovation baked in and the ability to have technology in there, you can then start to do extended outreach services into the community and start to add that technology into homes in a community, which it opens up endless possibilities.
Yeah, I see. Yeah, yeah, very interesting. And just going back, we were talking about before about these, the partnerships with your commissioners, the hospitals, and your homes. Often when I speak to care providers, they're, talking about those fraught, relationships where they're not, issues around funding and money, all comes into play and the politics of it all. What's your thoughts on that? I'm just curious, maybe perhaps as your charitable status, maybe that maybe makes it a little bit easier, maybe on the funding question, few bits to be able to run your services and also the funding that you get from NHS. So tell me a little bit more about that and how, particularly for those who are listening who are thinking about that, building those bridges and having good relationships and how to work through it when it's a little bit tricky.
I think it's probably still equally tricky for us at
Mm,
point. I
mm,
think it does help being a charity. People know that unequivocally the money that comes to HMT
yeah.
gets reinvested.
Mm,
Um, that probably does help. However, that being said, where there are frameworks, where there are traditional commissioning
mm,
methods in play, it doesn't probably make a difference. It still is
mm,
difficult
mm,
to support and help those people get into the beds that they need in a community
mm,
setting. I
mm,
think there's still a massive national challenge around fair price for care.
mm,
I think some of the prices and the costings that are associated with beds doesn't cover what that
mm,
individual needs.
mm,
And that's then not only unfair on the individual, but it's unfair on the providers.
mm,
What I find challenging is when you go into a competitive commissioning environment and there are providers who are willing to deliver care to complex individuals
mm,
at a particular price that probably doesn't reflect their needs.
mm,
I think that's difficult for us all then.
mm,
Um, so I guess my advice is, and where we've been most successful is where we've invested in our partnerships and
mm,
our relationships over prolonged periods of time. And what we've done is we've brought, the statutory services commissioners, whoever it is we're working with, into our services. We don't hide anything. We don't have egos attached to
mm,
what we do.
mm,
We don't have to be the most important person in the room. We bring them in. People know that everything we're about is our residents.
mm,
We allow them to work with us. I'm always open to learning. All of my
mm,
team are. If
mm,
somebody's got something that they can share with us that makes us better, we grab onto it. We're really pleased to take that advice.
mm,
If that does help. I think you can get into some struggles where people need to win. We try and go into our conversations just wanting to be open and learn. So bring people close, open up your services, shout about the brilliant things that you're doing
mm,
would be my best advice. We've
mm,
probably not been as good about shouting about our achievements, if I'm
mm,
honest.
mm,
It's one of
mm,
the things that we're working hard on at the moment,
yeah,
sharing, being more open.
yeah, yeah. No, terrific. Great. Well, we've covered a lot, and just before we were again, before we pressed record, we were just for the listeners, we were actually going to be talking about another possibility, which is about retention of colleagues.
Yeah,
We're not going to go into that now, but maybe that can be a follow-up episode because I know that's something also that you wanted to talk about. But I think that for those listeners, you can certainly from what I'm learning today is when you are like super clear on what you're doing, you have a super
yeah,
clear mission, you are very keen to build up those relationships, and it's very clear where you're heading, then that potential to have colleagues on board with you and to retain them and to be with you for a while becomes certainly nothing is easy, but it's certainly easier.
yeah,
But anyway, we'll have to park that particular
yes.
episode for
Sadly,
another day.
sadly.
On this one, well, the point I was wanting to get across, I think, is by listening to you speak today, you can get a sense of, how that is important to you as a mission. So that was the point I was wanting to make. So that's great. Now, Nicola, is there anything that we've not covered on this integration aspect that you feel is important to cover?
Oh, probably miss loads, but I think I've talked about the things that I'm interested in and passionate about. I think there's probably, again, it's probably for another episode, and there'd be somebody better to talk about it than me. But I think there's something around the role of housing in care and how care homes can work better with housing.
Hmm.
But yeah, no, I've really enjoyed it.
Great. Well, Nicola, thank you so much for being on the Care CEO Success Stories podcast.
Thank you for having me, Adam.